guys, this is Dr. Priya Singh. I'm a cosmetic dentist. I have a clinic named Impressionz Dental Care which is in Mumbai. Today's video is very interesting because there's one thing which I'm really not proud to share with y'all is that I have been duped and conned by patients in all possible ways that you can think of. Many a times we trust a patient and we feel the patient is honest and then we are disappointed. In my 10 years of practice, I have faced such an incident so many times. Sometimes the check bounces, many a times the patient finishes the treatment and then he says that I forgot to get the payment. Many a times they offer to pay by card and the card is not working. There are patients who would tell you that I will go to my house or ATM and get the money and then they don't come back. Some say that my friend or a relative would come and do the payment. That doesn't happen. Also, in middle of the treatment, sometimes the patient stops coming abruptly and then you've already invested your materials, you're ordered for your crowns or your lab works and then you have to bear those expenses. I am sure, like me, all you dental practitioners out there must have also faced such a problem some or the other time in their practice. So in today's video, we are going to discuss what are those tips and tricks that we can follow to minimize such incidents. What are the precautions that we should take? Now, what is the first step that we can do? When a patient takes an appointment for a consultation in my clinic, it is made very clear to him that my consultation would be charged. बहुत बार ऐसे होता है कि आप अपनी टाइम एंड एनर्जी इन्वेस्ट करते हैं एक पूरे कंसल्टेशन में एंड फिर पेशेंट बाहर आने के बाद बोलता है कि आई जस्ट टुक इट फॉर ग्रांटेड दैट इट इज गोइंग टू बी फ्री एंड देन रिफ्यूजेस टू पे. सो इफ इट इज मेड वेरी क्लियर फ्रॉम द एडवांस, such incidents would be lesser. Now, once the treatment plan is formulated or a budget is made, I make 2 copies. One, I give it to the patient and one I attach to his paper and keep it with me. It's not necessary that the patient would get the treatment immediately. Even if he comes after 2 to 4 months, that thing is very clear what we had quoted, because sometimes the patient also has a memory loss. No doctor, you said this. And then he refuses to do the payment. So always make a copy. I have said this time and again that make a copy and get it signed by the patient. So at least that hassle is saved. Now, do not give the patient any chance not to pay you. So keep a swipe card machine or a EDC machine in your clinic. All the UPI systems of payment should be available in your clinic, like Google Pay or Phone Pay, Paytm, whatever possible. Do that. Be with the current. Then, when the treatment is scheduled, try to take an advance payment. Now guys, all other medical field follow this. They take an advance payment only for the fact that it is possible that after the treatment the patient refuses to pay. Unfortunately, in dentistry, we do not follow that. But wherever possible, try to take an advance payment. If the patient is genuine, I don't think he should have a problem doing that. Now, if you don't want to do that, whatever treatment is scheduled, if it is a single appointment treatment like a scaling or a filling or a disimpaction, see that it is made very clear to the patient that tomorrow your treatment would be completed and I expect you to do the complete payment tomorrow. See that you stress it once or twice so that the patient knows that he has to bring the X amount and he has to pay you. Now suppose if you are giving him the benefit of installment payment like in implants or ortho treatment, जब आप फर्स्ट इंस्टॉलमेंट लेते हैं, सी दैट आप अपना इन्वेस्टमेंट या बेसिक बेयर मिनिमम लैब चार्जेस कवर करते हैं उसमें. Now, if I take an impression from the crown and the patient says that no doctor, when the treatment finishes, I will pay you then. I always say that I have to give certain advance to the lab guy, and if you do not make a payment, I would not be able to send your work to the lab. So when I say that, then the patient of course pays me because he wants the work to be done. Similarly, जो चीजें अगर आप इंस्टॉलमेंट पे दे भी रहे हो, टाइम एंड अगेन आप इन्फॉर्म करिए पेशेंट को जब आप एक्सपेक्ट करते हो कि नेक्स्ट अपॉइंटमेंट में पेमेंट हो. अगर आपको ऑकवर्ड लगता है, टेल योर असिस्टेंट टू इन्फॉर्म द पेशेंट ऑन फोन दैट today's appointment or the next appointment I expect you to do the payment. See that from your side it is very clear, because it should not happen that doctor, you did not inform me, that's why I did not bring the money. So see that from your side you are safe. Now, अगर आप recall करते हैं patients को for x-rays or follow up, do not charge them. That's a small investment that you have to do to make the patients loyal to you. But whenever there is a topic of payment, see that you do not hesitate. It's your right to charge them, and you should not feel bad to inform them. Many times we feel awkward to tell them, and then we have to face the losses. Do all this, I feel that the problems of losses will be lesser. Also, one thing, check bounce की जो मैंने बात की थी, whenever a patient, I avoid checks, but if the patient wants to pay by check, I see to that I do not finish his treatment until his check is cleared. That is one thing which is very important. I hope you follow that. Please do subscribe to my channel. Also do comment. Stay in touch. Bye bye.